Good afternoon, everyone. Thank you for joining SIEGE, the 9th Annual Symposium. Today, we have our charm session meet and greet, getting to know the team. Right now, we have Chris Haney, Associate Professor of the Bloomberg School of Public Health at Johns Hopkins, Kirsten Kohler, Associate Professor of the Bloomberg School of Public Health at Johns Hopkins University, and Natalie Exum, Assistant Scientist at the Bloomberg School of Public Health at Johns Hopkins University. We will also have Marcia Wills-Karp, Director of CHARMED, Professor and Chair of Department of Environmental Health and Engineering at the Bloomberg School of Public Health at Johns Hopkins University. So I will go to the back, and here's Marcia. Thank you for your presentation.
Thank you, and welcome to everybody online. It's our great pleasure to be part of this symposium, and we thank the organizers for doing an amazing job of pulling this several-day-long meeting together. And also special thanks to Jacoby Wilson, who's the organizer of this meeting, but also a member of our CHARMED Center. So what is CHARMED? CHARMED is an NIEHS, National Institute of Environmental Health, funded P30 grant that's focused on partnering with communities from, can I advance the slides, or who's advancing?
I'll advance. Yeah, there we go.
All right. That's focused on partnering with communities from southeastern Pennsylvania to Washington, D.C. But we also partner with other communities who choose to be affiliated with us. So even though that's our stated catchment area, we are flexible. So our mission, and what's unique about our center, is that we solicit environmental concerns from our community partners, and then we try to assist them with addressing those concerns through the various services that we'll talk to you about today. Chris? Yeah, there we go. Okay. So we accomplish our mission of improving environmental health across this catchment area by working with the communities, and we ask communities what are their most important issues. And then we try to connect them with both partners within our academic institutions, but also more broadly to be able to address these. And the main goal is to provide communities with evidence that they can take to decision makers and policy makers aimed at preventing or mitigating environmental exposures. So next slide, Chris. So this is the structure of our center. And the reason we show this is that community concern is at the top. And that's where it all starts. So we gather information, and Chris will talk to us more in a few minutes about that process. We get concerns from the community. We discuss whether we can directly partner and answer those questions, or whether we need to identify other partners in a broader landscape, or we just need to provide information to communities. And then we align through our integrated health science facility core. We assist the teams in developing proposals that are going to be rigorous scientifically and be able to be convincing to policymakers and others that the science is accurate and rigorous. We also have an exposure core that is led by Kirsten Kohler, that's on the call here, where we can assist in gathering certain types of information, particularly around air pollution monitoring and other measurement services. So the thing that we can offer to the community and the way that we're able to engage is by our pilot project program. So Chris, can you go on the next slide? Oh, I think I got a little louder. Can you go to I'll come back to the team. There we go. Okay, sorry about that. So we have in our budget for this center $200,000 a year to be able to work with our community partners. And we also have a rapid response up to 10K that we can distribute to communities within 48 hours of, let's say, a disaster that occurs in our community. We encourage these proposals from academics, from partnering institutions, to do innovative interdisciplinary research, but it has to be focused on community engagement. And we will assist with putting these proposals together, and we can distribute 40K to each recipient of these grants to help incentivize and to initiate studies. If greater resources are needed, we can assist with other types of funding requests on a more global scale. So Chris, sorry, can you go back 2 slides to our team? Okay, so this is our broader team. All of us are not on the call today, but our community engagement core, and I think Chris is going to introduce his partners in a few minutes. But here is Shakobi Wilson and Chris, who will lead this core, and he'll introduce the other members in a moment. Myself and Ram Ramachandra are the co-directors of CHARM, the Integrated Health Science Facility Core that assist communities and academicians in the design of their studies is Neeru Pucha and Pete DiCarlo. And the Exposure Characterization Core, led by Kirsten, also involves Pete DiCarlo and Karsten Prasse. All of these individuals, with the exception of Shakobi, are at the Johns Hopkins Bloomberg Public Health School. Next slide. Okay, so these are some areas that we focus on and is our expertise within our academic group, but we can branch out beyond these, but these are typically focus areas for us: cardiorespiratory health and airborne contaminants, chemical mixtures, emerging contaminants in health, community, social and environmental determinants of health, and neurological health. And we have working groups that have expertise in these particular areas that meet routinely to discuss how they can better engage the community, both the academic and the community partners in these particular subject areas. So can you advance a couple slides? There we go. Yesterday, we had a great session of the pilot grants that we have funded so far. And just to give you an idea of the spectrum of things that we're involved in, give you ideas about how you might partner with us. Chris Haney and his student Lauren Deans presented a fantastic study yesterday that they've been doing with partners in Curtis Bay, looking at the effects of the coal dust in that community on the community members. Anna Rule and Katie Kurowski presented a work that they're doing with Delmarva communities on air monitoring around poultry emissions that are quite disturbing and potentially harmful to the local residents. Sarah Leupold is an assistant scientist in the department. She's working with the Justice and Southeastern Pennsylvania communities, and they're doing a survey, just like we're doing with CHARMED, on a larger scale of what those local communities are concerned with. And they've got a rich data set to work with from those surveys. Kyle Morit is from mental health. He's doing a study using data that was collected in Baltimore about neighborhood walkability and lifestyle and how that impacts on cognitive health, how it impacts negatively, and what people can do to improve their cognitive health and prevention of diseases like Alzheimer's by having more walkable spaces and availability for residents to be more social and to get out and network and to exercise in their communities. So next slide. So just a little bit more about the Integrated Health Science Facility Core. We have several parts to this. We help form the partnerships with communities. We help plan and we help develop an agreement between the communities so that there's no misunderstanding about what the responsibilities of the community and the academic partners are. This is worked out at the initiation of the project. We help in the execution and translation. So next slide. Okay, so execution is rallying the teams, the cores to come and actually make the measurements, etc. Translation is where we help to support providing that information to stakeholders, like local, state, government, federal stakeholders. So we have a team that are well versed with reaching out to these individuals, and we hope to make those connections once we have the data and the evidence to support changes in policies. So, okay, so I'm going to turn it over to my partner here, Chris Haney.
Great. Thank you so much, Marcia. So we're really lucky with the SIEGE Symposium today to have as the academic co-lead of our community engagement core for Charmed, Dr. Jacoby Wilson. And the way that Marcia described the overarching focus of this center is to take in community concerns and then develop research capacity around those. We wanted to structure the community engagement core that would really support that. So we have myself and Dr. Wilson as the academic co-leads, but then we wanted to have two community co-leads of the community engagement core. And that's Walkiria Poole, who's the president and founder of Centro de Apoyo Familiar. And Ms. Poole works very closely with Dr. Wilson in many regards across many spheres of his work at SIEGE. And then Ms. Shoshanda Campbell, who's the Environmental Justice Coordinator with the South Baltimore Community Land Trust, and also a leader in the Mid-Atlantic, the broader regional justice coalition. We also have really wonderful support from a new faculty member, recent Masters of Public Health, Masters of Science in Public Health graduate, Maddie Alberg, who just joined our department to help around with Charmed and community engaged work in general. And Dr. Anna Rule, who's an assistant professor. She's been helping out with the community social and environmental determinants of health thematic research group, and also bringing long-standing community partnerships that she's had with communities across Baltimore, including Turner Station. So we have been forming through the leadership within Charm that Marcia described and the CEC. We've been focusing our attention around convening monthly partnership board meetings. That's an environmental justice stakeholder group comprised of, and I'll get a little bit more into that, but we wanted to really establish this so that we could be meeting on a monthly basis and start that process of funneling issues in from community, neighborhood groups, and other stakeholders who are working on these issues that relate to environmental justice and concerns about disproportionate and adverse exposure and health burdens. So here's the picture of our first convening in January, which was really exciting to be able to be in person as we were all coming through the pandemic and transitioning to the pandemic plus normal. So just as Marcia went over the structure, community concern comes in from the top, and then it's flowed through, often through these monthly environmental justice partnership board meetings. And then we try to funnel those through the Charmed Center. A lot of that happens through the executive committee. That's the representation from across all of the cores where the committee comes together. Myself and Dr. Wilson and Shoshanda Campbell had been standing members of the executive committee, where we'll bring issues and we'll discuss them. We'll say, do we possess the capacities? Is it a good fit? Who would it fit with? And how can we usher the referral of the issue through? So that's sort of the process of intake. And then as it comes through, the CEC has three aims. One is to really build the capacity to conduct community engaged research. That involves training, running workshops and seminars. We're going to mention 2 workshops that we're kickstarting as a part of the SIEGE Symposium tomorrow in person. This symposium itself is a part of Charm that we want to support, co-sponsor, and really help elevate understanding of the impact of community engaged research. And then I'll also spend a little bit of time talking about a youth education and educator training program that we're getting started. So aim 1 is really about capacity building through trainings, workshops, and the education of youth and local teachers. Aim 2 is about these partnerships, building, fostering new, sustaining existing partnerships. And that's really the Environmental Justice Partnership Board is the core, the living, breathing heartbeat of the stakeholders that we bring together and the issues that they flag for us. Aim 3 is, what do we do? How can we activate scientific resources around those concerns? And it could either be an issue about which there's a fair amount that's already known, lead, for example, lead in paint, lead in drinking water. We can say a fair amount, and we can provide inputs, rigorous scientific inputs to summarize the evidence as inputs, as Marcia mentioned, to be considered in discussion around policies. That's Aim 3A. And then Aim 3B is, we recognize that this is a question that requires new data collection around questions. Is there an exposure occurring or not? And often it may, the etiologic agent may not be known. So it's often trying to figure out and work in partnership with communities to make actual exposure measurements. And that's Aim 3B. And often that triggers access to working on developing pilot proposals or gaining access to some of the rapid response funds, or also identifying and making matches with faculty who may have ongoing projects where that community concern can be aligned with their ongoing data collection. So, as I mentioned, the Environmental Justice Partnerships Board, or EJPB, is the heartbeat. And we, since we started the initial meeting in January, we've had over 58 community and stakeholder partner organizations. There's a vast geographic representation here. Is a map you see all the way up to the region of Pennsylvania, as Marcia mentioned, into outlying in areas surrounding Philadelphia. Lots of representation in Maryland, but we do have partner organizations in Virginia, even as far as into South Carolina, where we had participants in our EJPB meetings, which are in person, as you saw by the picture, but they're also virtual. We want to create an opportunity to have broad connectivity. Notwithstanding the breadth of the geographic area, 78% of our community partner organizations and stakeholders are in Baltimore, in Maryland, and then also furthermore in Baltimore. And that's just a virtue of we want to help provide supports and provide an impact on many of the environmental concerns in Baltimore. So we're growing over time. Is December, January, February, March. Apologies, I meant to say December was our first meeting. And now we have 88 unique organizations and 229 Environmental Justice Partnership Board members as of September 2023. It's a mix, just under half are nonprofit organizations and community residents, many academic institutions, which is good to see, University of Maryland, Hopkins, other universities. And then we have also primary and secondary schools. This would be high schools, in other local primary schools. We have some private organizations, and it's great that we have had pretty consistent participation by several key government and regulatory agencies. One example, Maryland Department of the Environment is frequently at our stakeholder meetings. Range of issues from water, air, soil, community redevelopment, fossil fuels, agriculture, transportation, housing, waste, ecosystems, food, and climate change. So really the full spectrum of issues that the stakeholders are coming together and flagging for Charmed. One area that's really exciting, it's an Aim 1. It has to do with youth and educator training. And this summer, we just completed an 8-week in-depth paid scholars program. It's a summer youth environmental justice scholars. We call it the SCI-EJ scholars program. And tomorrow there's going to be a great panel where these 4 wonderful youth who came together, Tasia Thompson, Raven Veillon, Vilma Gutierrez, and Carlos Sanchez Gonzalez, all from local South Baltimore communities, grew up there and also went to high school there. And now through an environmental science class that they take at Benjamin Franklin High School, extending it into the summer. These are students who, as a part of a year-long class, have been getting access to educational opportunities about what is environmental sciences, what is environmental justice, what are the features that I can see or activate with my 5 senses in my neighborhood that could be explaining the kinds of range of environmental exposures in my community. And as a result of that work in high school, now we have an opportunity to create an 8-week in-depth experience where they can keep collecting data, keep understanding this, getting greater depth of the scientific method, and gain access. They're each brought on and they're hired in our department in environmental health and engineering, so they have access to all the resources of Johns Hopkins University. We give them lab tours, we activate lab measurements, they learn the SOPs and get trained in a lot of the data collection. So tomorrow there's a great noontime plenary session where they're going to be highlighted with their work with this inaugural cohort. And so other examples of Marcia talked a lot about this, but it's just wonderful to see some of these partnership discussions that happen initially at these EJPB meetings develop into data collection. I mean, she mentioned the first two here, but the third is a wonderful one in the Mount Winans community. They were gracious enough to host Charmed during one of their monthly meetings, and concerns with the rail lines emerged in terms of noise pollution, in addition to air pollution. And many of the faculty have gone and followed up to try to make it possible to make measurements with the noise monitoring app on mobile phones, and trying to really take those steps to figure out how to bring scientific measurements to bear around these concerns. Another great example is Turner Station conservation teams. They were gracious enough to host an Environmental Justice Partnership Board meeting to look at air, noise pollution concerns, and whether or not some of the capacities that's involved in a health impact assessment might be able to be brought to bear around a lot of their concerns with proposed Baltimore County traffic and traffic development plans, which could have there's a lot of community concerns about their impacts on neighborhood environmental quality, health, and well-being. Also, we'll hear a little bit more from our counterpart later, but they're doing great work around water infrastructure, aging water infrastructure, and concerns with pathogenic exposures as well. So tomorrow, just to highlight, there's two wonderful sessions on this AIM-1, the idea of kickstarting workshops. We in the academic realm have begun to see community engaged principals make their way through many of the NIH opportunities to support research. Many faculty are now really embracing community engaged research, but we wanted to have a two-part session. One, the principles and the theory and the practice of community-based participatory research and community engaged research in the morning. That'll be led by myself, Nicole Fabricant, and Matthew Alborg. And then the afternoon, or the lunchtime plenaries, the youth highlight session in the afternoon is hearing from community leaders, community partners about what worked, what didn't work, as a second bookend to this initial two-part workshop on community engaged research. So I'll hand it off to my counterpart, Dr. Kirsten Kohler now.
Great, thanks, Chris. So I am the lead of the Exposure Characterization and Modeling Core, or ECMC. And so we kind of work within that structure that we've been talking about so far today, of being able to provide research support for monitoring, modeling, biomarkers, and an interpretation of those results once a community concern has been brought to the team, a study design has been identified, and then we can help provide resources and expertise on how to actually collect those measurements. Next slide, Chris. So we have a lot of different laboratory services that are available. In some of these, we might think about being able to address community concerns from within the laboratory. These allow us to deliver and characterize concentrations of airborne contaminants in exposure chambers, where we might be thinking about trying to understand the actual health impacts of these through exposing cellular-based models or animal-based models. We can do that by concentrating ambient particles, so taking air from within Baltimore but outside the building, concentrating it, and then sending that to different types of toxicological systems to understand the mechanisms by which health effects may be happening. We can do these also by taking lung cell cultures, growing those in the lab, and then being able to expose them to complex mixtures of chemicals. We have large chambers in which we can put animal or even humans into, with appropriate controls, of course, but be able to look at how specific types of processes generate different pollutants that we might be interested in, or be able to simulate specific activities and think about how the particles that are in there, the gases in the air, all could contribute to different ranges of concentrations from specific exposure scenarios that people may encounter. Next slide, Chris. We also, of course, are very interested in being able to work with communities on field work, being able to sample different types of pollutants in specific environments of interest. So this could be at the ambient air quality, household level, or even personal exposures, identifying equipment that individuals could carry around to be able to see how their exposure varies between their household, their work, as they're traveling, and different activities that they do. And so we have a lot of different types of measurements that are available. We can do area sampling of particulate matter. This allows us to collect those particles onto a filter. From that, we can do some kind of standard characterization, similar to what like the Maryland Department of the Environment can do, but also add, more size resolution, more chemical speciation than is typically done through the routine monitoring network. As I mentioned, some of these are small enough to be able to carry around and be able to understand how those concentrations vary in the different places where we spend time. We can also look at bioaerosols. Of course, we're hopefully still coming out of the pandemic, being able to look at viral particles, but also bacteria and fungi and other types of bioaerosols that exist. We also don't only have to look at air pollutants in outdoor air, but can think about what's going on inside households. Of course, most of us spend most of our time indoors, and so what's happening inside our homes is very important. In addition to the air pollution, we also have capabilities of measuring things like settled house dust. These can have lots of allergens that can be problematic, particularly for susceptible members of our communities. People with things like asthma or COPD might be particularly susceptible to exposures to those allergens. And then lots of different types of gas phase measurements as well. But I've talked a lot about the particles as being a particularly important part of our exposures to air pollutants. But of course, lots of other types of chemicals that we can look for. Next slide, Chris. So these are some pictures of the things that I mentioned on the previous slides. This is our whole air monitoring chamber, and you can see those are those tall standing fans. So there's 6 of them there. Something, so it's a pretty big space to be able to look at doing different kinds of things. The smaller chambers here can hold animals to help us understand specific toxicological mechanisms. We can also do these with cells, in which we grow like lung cells on little plates and then can expose them to different types of aerosols to understand at an even cellular level what's happening. And then more examples of how we can take outside air, be able to concentrate it and send it to these different exposure pathways to understand these mechanisms. Next slide, Chris. So these are just some pictures of the types of equipment that are available. You can see that a lot of it is relatively small, lightweight, kind of handheld, could be taken around between different places and be useful to look at particles, to look at gases. Chris, I think if we click through, Chris mentioned the project where we were thinking about noise. I want to also kind of mention we have the capability of going from, you see a picture here of a mobile monitoring van that's just starting to come online, which has state-of-the-art expensive equipment that can do super detailed characterization, to low-cost sensors and kind of everything in between. If communities have obtained some funds to be able to think about deploying low-cost sensors into networks, we can provide expertise on selecting those. It can certainly be overwhelming to Google these kind of things and see how many results come up and be able to decide. And then for the noise, again, we have kind of a range from kind of state-of-the-art equipment to options that you can use your own cell phone to do and be able to provide information there. Yeah, go ahead, Chris. And I think these are just some cool pictures. So these are the types of analysis we can do, from weighing things to looking for specific chemicals to looking for metals, and even being able to look at individual particles and see what's inside them. This image here is showing us different types of chemicals that are present within one single particle in the atmosphere. So really high-tech technologies that we have access to. And finally, you might also be interested in thinking about questions that are best answered with perhaps either a combination of modeling strategies as well. Often people are interested in how a specific facility or other type of source is contributing to air quality or water quality in their community. And just doing measurements, it can be difficult to attribute those to any specific source. And so a combination of modeling can help us address those questions. And so, being able to provide expert consultation and training, pull together the measurements and the modeling, provide data visualization that can help inform community members and other stakeholders, as well as working with the IHSFC, Marcia mentioned before, on these study design aspects. And so my email's there if people are interested in reaching out to learn more about services we can offer. Thank you.
Thanks. Chris, if you could just advance a couple more so I can get those other two. There you go. Thanks for the opportunity. Hi there, Dr. Natalie Exum. I'm working on drinking water and just wanted to share a little bit about my experience working with the CHARM Center on a subject that's near and dear to my heart, which is drinking water inequities in the United States, and just share a little bit about how a community concern from one of our partnership board meetings really helped to deepen our understanding of what was happening in the environment, actually with what was happening in the health of our communities. So just a brief overview, we have some of the best drinking water in the world here in the United States, thanks to the Safe Drinking Water Act and Clean Water Act. That is really in jeopardy with the aging infrastructure of our aging pipes, aging pump stations, aging everything, and layer on top of that really the neglect and disinvestment that has occurred in our Black and Brown communities in the United States. When you layer on top of that climate change, and for those that know the American South, that's Jackson, Mississippi in the background there, just a demonstration of the Pearl River, which peaked from heavy flooding around this time last year and made what was a suffering drinking water system, boil water notice advisory after boil water notice advisory. The climate change event really broke the camel's back there. And so there's just a lot of dynamics at play here going on in the pipes that we can't really see except the Flint. You can see there the Flint water crisis. You can see the water actually really does come out brown or yellow when you have as high corrosivity as you had in the Flint water crisis. But what others don't know is that there was a huge Legionnaire's disease outbreak after the lead in the drinking water crisis there. And I'll talk a little bit more about that here, but just, Chris, you could go back one more, just to share a little bit that there's a lot of investment going on here in drinking water here in Maryland, and especially in Baltimore. That there was a community member from South Baltimore here in this nightly news report earlier this year, sharing her concerns about the drinking water in Baltimore for her family. And she gives bottled water for her children to drink and brush their teeth with. She's boiling water there for other uses, but growing concern from the community itself. And Chris, if you could advance to the next slide, I'll share a little bit more about just what Legionnaire's disease is. If you could just give me one more advancement. It's a severe pneumonia. It has a high case fatality rate, 10% in the population, 25% if you're in a hospital. It comes through basically breathing in aerosolized water droplets. So from your pipes, these bacteria like to grow in the biofilm, kind of the sludge around the edge of the pipes. And we can get it from our showers when water stops running, when you have stagnant water, when you have low chlorine, when the water is warm, those create perfect conditions for these Legionella bacteria to grow. And actually we have a higher rate of Legionnaire's disease here in Baltimore than we do when you compare it across the country. So trying to connect some dots here about what's actually going on in our communities and in the drinking water system. It's not regulated for under the Safe Drinking Water Act. It's very rarely monitored in the environment. So we have a lot of sporadic cases popping up. You only do these environmental investigations when it's outbreak driven. And we just really don't know where people are getting these infections from. So we've always known that. And then Chris, if you can go to the next slide, take us to an Environmental Justice Partnership Board meeting at the Turner Station back in March, when we had a community member come and share her experience about getting a very severe, it was a very powerful story she shared about getting an infection and calling the health department, and there's just no money for home assessments. It's not something that public health organizations really are equipped to do. And so through just consultation and technical expertise, we're able to connect that. Actually, she herself, as a very motivated woman, got the water sample sent off to a certified laboratory. We were able to connect her clinical diagnosis with the environmental diagnosis and see that she'd actually got that infection from her bathroom sink. And so that has really deepened our understanding about what the community's experiences are with this disease and their drinking water. And we're now developing household water sampling. We're thinking through citizen science. So how can we use not just our equipped with what our labs are equipped with at Hopkins, but how do we also use the sample collection process to further the community's understanding about their own drinking water. And so just last slide is a demonstration of how we actually are monitoring at community water points the fluctuation in chlorine over time in the Baltimore's water system. That green line is where the lower limit of the regulation of free chlorine in the system. And you can see over time, there are just some little blips where it drops below as water enters into our buildings. It drops below where that regulated limit is. When you average it out, it's above it's not a violation of the Safe Drinking Water Act, but those create vulnerabilities for Legionella bacteria to grow. So also now forming a drinking water community advisory board and thinking through how do we responsibly share these results back, because you don't want somebody's tenancy in their home, if they're a renter, to be jeopardized by sharing this information. So this Charmed Center has allowed us to have this interaction with the community and just deepen our ability to understand Legionella bacteria and Legionnaire's disease in Baltimore. So happy to pass it back now.
Okay, Chris. So we'd like to engage the audience and the speakers on the panel to talk to you about how can we best assist you in your communities, whether they be in Baltimore or elsewhere in our catchment area, in your environmental health work. And if you have or you're actively involved in these types of studies, you might feel compelled to share some best practices with us. So I cannot see who's on the Zoom, so I'm not sure who will assist us with seeing if people have questions. The organizer?
Yeah, Dr. White or someone, I don't know if there's a facilitation of any just chat questions, or if participants can unmute, that would be good to know as well.
Mm-hmm.
So participants cannot unmute, but they are able to leave comments and questions in the chat. So far, I haven't seen any, but we'll see if any come in.
Okay. While we're waiting on people to get the courage up, perhaps, to ask a question, can we go to the next slide, Chris? Okay. So if perhaps you want to engage with us and you don't want to speak at this point in time, we have our contact information. You can contact us through our website or through our emails. So please don't hesitate to reach out. And if you leave a note with us, we can add you to our mailing list to be invited to our community meetings that Chris described. It's a good way to get involved. And as he pointed out, they're hybrid. So you can come in person if you choose, but you can also be online. And these usually take place at 6:30-ish in the evenings to make it easy for people to attend. And we encourage everyone to attend. And if you do come in person, we usually provide food because it is around dinner time. But what I wanted to point out through all of these presentations is that if there's a need, we can also connect people with our clinical colleagues. So for instance, in the work that Natalie was discussing with you, there may be instances where we need to connect or refer somebody to clinical colleagues of ours. We also, for instance, in the noise study, what we heard from residents is that the noise is not only annoying, but it keeps them awake and they're suffering from the ill effects of lack of sleep and disruption of their sleep. And Niru Pucha, who's on our group, who I told you leads the Integrated Health Corps, is a pulmonary physician who is willing to talk to folks about how that impacts their sleep. Other things that we worked with the community during the recent Canadian wildfire pollution that made its way to Baltimore, we provided information to our community groups about how best to protect themselves, particularly if they have asthma or other pulmonary diseases. So we're working on many different fronts to respond to the communities. Another example, we worked with some of our contacts in the Maryland Environmental Facilities Group when the train derailment occurred to understand exactly what was happening with toxic water being transferred to Baltimore. So we are here willing to engage with you on any number of issues that come up, whether they're persistent problems or something that happens just recently, or as Chris pointed out, the rapid response, we can help you to collect data on some very acute event. So the goal is for this to be a sustaining effort, something that continues for many, many years. So we hope to be a trusted partner with the communities and be able to improve the environment for all of us in an equitable manner. So I will open that back up since I don't see anything in the comments to anybody on the panel that wants to add additional comments.
Yeah, I think it was so nice to hear it all together, and Natalie, to see your work in the water infrastructure space. So I would just be, curious to know a little bit more about, the process of navigating environmental data collection and communicating things to the community. I think that's a big open area, and at the national level, there's a lot of discussion about how to do that well. So, that's another area we're charmed with our focus on community identified issues is, thinking about how to collect data and then also communicate back what it means in ways that can be useful. So I don't know, Natalie, if you have any, that was such an amazing, the example you gave about identifying a source of contamination. I think that's powerful. So that's a key thing within CHARM. So I don't know if there's more richness there.
Yeah. And, this particular community member, I learned so much more from her probably than I was able to provide to her. Just hearing her personal story about, leaving the ICU, having almost died, and then going to the health department to say, okay, like, I want to find out what's getting me sick in my house. How do I find that out? And all that the public health department was able to give her were the names of some lawyers. And, one example, I think how the CHARM Center could really help us in those situations are, maybe we do, you need to collect the water sample pretty close after that infection to really, have that surety of where your infection came from. So, that the availability of, within 48 hours of some sort of disaster, having funds that are available to do that sampling. So to your question about reporting results back, I think we need to be really responsible and careful with this. And that's why I think, just this one person, I've wanted to be careful about saying, your whole water is unsafe to drink, because then you make people feel like they have to go out and buy bottled water, and they can't bathe or they can't shower. And so how to, get certain numbers that may or may not mean something for public health. But I think the key here is for us to be pairing okay, we found this in your water, but it can be removed with this. And so equipping individuals to say, what, actually, one of those Pure or Brita or, activated carbon water filters that are relatively cheap to buy at Walmart, that can take out what you're concerned about here. Is huge. And it does that for lead, right? So I think not just giving people the data back, but also giving them actionable, affordable, and and guidance, and here's how you maintain it. I think trying to provide that as well, not just the data and the numbers. And we're learning in this process right now how to do that.
So Kirsten, you may want to follow up with another effort that we partner with, the Breathe Center, and the types of connections and information they can provide as well. I can't hear you. You must be on mute still.
You're muted. Sorry. One of these days we'll learn. I was thinking when Natalie was talking about that's a lot of what we're trying to do. And if you go to our website, you can see a handout that we made for the wildfire events of trying to give people actionable information of things that they can do at low or no cost to be able to minimize their exposures when, particularly things like wildfire smoke really not in any of our control, right? So we all have to breathe wherever we are and make some decisions to be able to reduce our exposures. And so that document that we put together, a little flyer that we shared on our website, was also made in collaboration with colleagues of many of ours at the Breathe Center. Breathe Center is also at Hopkins, and is collaboration between people at the School of Public Health and the School of Medicine, really focused on being able to understand how air pollution, diet, other environmental factors can impact respiratory disease. Of course, because in Baltimore, the rates of childhood asthma are higher than the national average. We spend a lot of time thinking about that. COPD is also very important among the older people in our community. So, we think about how being able to improve environment can really have benefits for people, particularly those, with these conditions that may make them more susceptible to the impacts of exposures to air pollutants, and not just what's outside, but also, using candles indoors, or exposure to cigarette smoke or different things can have real impacts. And so trying to come up with some recommendations for ways people can reduce their exposures is a lot of what we're trying to do. And I also, I guess, would put out a plug if there are aspects of things that you would like to learn more, or can we provide more education? Can we give suggestions on things that you're thinking about? We're happy to do so. So please reach out through the website or email any of us directly to put those kind of things together and be able to share with everybody.
Yeah, and Kirsten, building off of that, just to give an example, we've had community residents and community members reach out to us. We've also had local government officials reach out to the Charm Center. And one example of that is that we were able to go down and meet with the community in southern Maryland, north of DC, where there were concerns by the local elected officials in this town with respect to some of the coal-fired power plant operations, and just the transport of coal and storage of coal, and then also how they manage the coal ash after combustion. And we as Charm would love to be able to be invited to learn about the issues. And I think that's just, as Kirsten mentioned, doing it with residents, be it around concerns in their homes. Natalie mentioned about that in their homes. I think really we as a center want to be going, meeting you, learning about the issues, and then figuring out what could we potentially do together to try to begin to address some of the issues. And so different members of the center may become, and certainly the Community Engagement Corps wants to be there every time if possible, or as much as possible. But that's something I think that would be a great thing for us, is to be able to just hear from more neighborhood and community members about their issues.
Mm-hmm. So, Chris, lifting up something you presented earlier, is the goal to also educate the youth in our communities around these issues, but also to perhaps prepare them for careers to get involved and to work on some of these issues themselves. So do you want to say a little bit more about that? Not stealing the thunder for the next session, but just to highlight it a bit.
Yeah, absolutely. I think that is a big goal of Charmed and the institute that supports Charmed, the National Institute of Environmental Health Sciences. We are focused on trying to build capacity that is scientific and technical capacity, but also build educational capacity in order to try to have more people appreciate, understand, and become part of trying to create solutions for big environmental health problems. So the youth that we've been able to engage with in this first year are great. They have diverse interests coming in to the 8-week program. Some wanted to be anesthesiologists, some wanted to be chefs, others wanted to be authors. Others were already, while they were in high school, participating and in activism and advocacy as a part of local advocacy organizations. And so I think it's a really great opportunity for us across whatever issue, be it water, Legionnaires, air, exposure, indoor, outdoor, to try to listen to the community concerns and look at the whole picture of the context out of which they're coming and try to really create opportunities for participation in the research and the scientific process that could also help build skills. And that's through the youth program. What we're trying to do is to harness that interest, because it's the lived experiences often of the youth with the environmental challenges, and create examples and opportunities to do and to potentially do something about it. In the summer youth experience, they were focused on some of the concerns in South Baltimore with the coal terminal and identifying areas where there's just a lack of data. There's a lot that is said about what is being experienced from the perspective of neighborhood residents or elected officials, understanding, but when it comes down to it, there's actually very little data. There's very little objective information about the presence of exposure to different air pollutants that can be attributed to different sources. So, just getting youth to understand what's needed in that dialogue around policy decision making and what information can be useful. I think that's also an important thing that we can do in Charmed.
Absolutely. So I'm going to, in the last few minutes here, we'll give another opportunity to the folks in the audience online to ask a question, tell us about an experience, or set up a time to meet with us or talk with us. Anybody interested? Don't be shy. Okay. I'm not sure exactly how that works, so hopefully we're not missing comments. All right. Anybody have any other additional comments they'd like to make?
Maybe one other thing, Marcia, that might be helpful. I think there are 8 attendees. It's just to reiterate that although I think we were maybe talking about some examples that might make it seem like we're focused on Baltimore, which a lot of the work is there, but we also reach out into rural areas. So just to mention, we even through a Charmed leader, Pete DiCarlo, had met in southeastern Pennsylvania, in Philadelphia, had an Environmental Justice Partnerships Board meeting there. And certainly there are many issues which affect rural neighborhoods and communities. And we've had great meetings with some of the advocacy groups that focus on river keeping and coal ash and animal manures and nutrient management and the health concerns related to that. So just to give that picture is that many of the examples in the pilot projects, they are also relevant to the rural parts of the region.
Yes, one of the ongoing projects we have is with the Potomac River Keepers, who are concerned about coal ash and other things finding its way into the rivers and streams in the area, which is a great concern because we're all, using those for recreation, but also sources of water, etc. So it's important for us to know about these contaminations that are happening more broadly in the region. And Chris, I believe we've had other folks that are working with the Eastern Shore on some of the agricultural concerns.
Yep, absolutely. With concerns related to industrial food animal production facilities and the environmental exposures associated with those facilities. Yep.
Mhm. Okay, so I would employ you again to please connect with us. And if for some reason you don't get this information, I'm sure the organizers of the meeting, including Dr. Wilson, would be happy to connect you with our group. And we would love to have you attend our meetings or reach out to us with ways that we might be able to partner with you. So we appreciate your attendance. And I think we will probably end there, give you back a few minutes perhaps. And Chris and others can prepare for their next sessions. But you might want to remind folks one more time, Chris, about what's next they may want to attend.
Yeah, sure. So just a reminder, tomorrow morning at 9:30, there is a workshop on best practices of community engaged research that will be from the perspective of some of the academics, myself, Nicole Fabricant, who's an associate professor at Towson University, who's partnered with many community organizations in Baltimore, and then also Maddie Auborg, who's been a key fabric in the partnerships with many of our Baltimore community organizations. So that'll be us in the morning going over some of the best practices from the principles and theory standpoint. And then in the middle of the day at noon, our summer youth scholars will be presenting from Charmed, and also Miss Walkeria Poole has some health promotoras who've been doing climate and health on the Promotora model, which is wonderful. They actually, can you believe it? They produced a graphic novel. They wrote a book this summer that was all about an example of how to disseminate a message around climate and health and environmental health. And I believe they're going to present the book tomorrow, which is going to be really exciting to see at that noon session. And so that's exciting. And then in the afternoon, there will be a hear from the community leaders from their perspectives about what works and what doesn't work. When, academics have the best of intentions, we want to partner. We want to try to help out meaningfully. But just hearing from their perspective about some experiences that may help people, try to get those partnerships on the right track. So that's the afternoon session of the 2B workshop. And that'll be with Ms. Walkeria Poole, Shoshonda Campbell, Dr. Melanie Thomas. They're both from South Baltimore Community Land Trust. And I believe some other community partners as well who'll be on a panel. Mm-hmm. So tomorrow is a great day, and it's in person. So that's exciting to be able to see people. Mm-hmm. And it's a Saturday. I recognize that, but the youth are so excited because they're back in school, and having it on a Saturday was really, really strategic by Dr. Wilson and the team so that they could attend and be a part of it. So it should be a good time.
Having seen a preview of at least one of the scholars, they're very inspiring, and it's just so exciting to see their level of enthusiasm and excitement for their experience. So I would definitely recommend attending if you are able to. So anybody else? Any last comment? Okay, well, thanks to the panel here, and thanks always for your engagement in Charmed. And I appreciate the organizers for giving us this opportunity. And we hope that those listeners will choose to engage with us in the future. So have a great day, everybody.
Thanks so much, everyone. Bye.
Bye.